and welcome everyone. We sincerely appreciate your willingness to participate and engage in today's deliberations and to contribute to building one nation, one health, and one future. As I reflect on where we are in terms of our ambition to achieve Viksit Bharat and Amrit Kaul in 2047, I think we are at a defining moment. And I think the scale, intensity, and resolve of being able to forge meaningful and sustainable public-private partnerships will determine the velocity of our ability to accomplish the goals that we have defined for ourselves. So this is really a defining moment in nation's history. And towards that, the Office of the Principal Scientific Advisor has just announced very recently a huge big initiative called One Health Mission. And this is a significant step in the direction of addressing health, productivity, and conservation challenges that our nation faces. If you go to their website, there is a very succinct one-pager which basically describes this as a very comprehensive and integrated framework to coordinate a lot of activities across multiple departments, across human health, animal health, and plant health. These verticals and integrating these verticals will be fundamentally critical to achieving the overall pandemic preparedness and disease control. That is the overall objective of this. And we are very, very happy that this particular mission initiative received cabinet approval on the 29th of February, 1 week before the Election Commission announced the dates for the election. So it happened 1 week before that. So it's live. And with that, I'm going to kind of migrate into building the relevant context for today's meeting in terms of how does DIISHA fit into the One Health Mission framework. DIISHA is a very unique kind of a pilot that has taken the DIISHA team more than 2 years of active consultation and recommendations that came through 5 formal working group meetings, innumerable 1:1 meetings with these 12 government departments, NGOs, private entities, quasi-government departments and institutions like the Public Health Foundation of India, for example, just to name a few, and also state government engagement. And that has led, after 2 years, to be able to design a health tech pilot which will revolutionize last mile delivery by building a data-driven healthcare ecosystem especially for our rural population. And when I talk about the rural population, because rural is a very nebulous word, it's about those 600 million fellow citizens that reside beneath the primary health center and the community health center space, which are significantly underserved and have practically very little access to healthcare. And that significantly impacts disease surveillance and population health management. That's the focus of DIISHA. And at the heart of DIISHA is our nearly 1 million frontline health workers who are endearingly called ASHA workers. ASHA in Hindi means hope. And these have been our COVID warriors and our Anmol Ratans, as we say, and they were globally recognized for this heroic effort of being able to vaccinate a substantial portion of this 900 million Indian rural population in record time. And that is what we really need to harness, which is really to be able, DIISHA will empower and digitally upskill them using the latest available technology and device upgradation that is available in the marketplace, and build an entire tech and data ecosystem around ASHA, from validation and identification to screening, care management, to rural outreach and delivery, and communication workflow that will help us establish arguably Asia's largest data bank. And so that's the one big aspect, which in short talks about driving access and collecting high quality granular data. The third big aspect is about data, DIISHA's very unique annuity-based financing model. And that basically is grounded in the principles of circular economy that will be able to, over time, drive a sustainable financial model that will contribute to the nation's objective of driving the GDP contribution from 2% to 5%. And this is where DIISHA will be able to address and complement and supplement nation's efforts around grappling with the three big challenges that we have grappled for the last 77 years, which is to be able to address the issue of high mortality rates due to non-communicable diseases, but also due to pandemics. If you just read the latest statistic, 70% of deaths in India happen because of non-communicable diseases. The second big challenge that DIISHA will help address is to be able to provide this rich, granular, grassroots clinical data that will lead to meaningful, analytics, and will be able to help address, the big issues of surveillance and population health management. And the third big issue that DIISHA will help sustain is the issue of lack of adequate financing that has hindered our ability to be able to build the requisite capacity and capability of the healthcare system, and most importantly also to be able to help direct the large national health and welfare programs much more effectively to create the desired impact. And finally, where we see DIISHA fit in and be housed under one health mission, DIISHA is going to help on three big counts. The first one is that it will be a ready-made pilot that will help test One Health mission. If you look at the spectrum of One Health mission, and there are a lot of slides that are going to come up, which will show that there's a huge dependency on inter-ministerial and interdepartmental coordination. There are 14 departments envisaged under One Health mission. In DIISHA, there are 12 departments, and there are about 6 departments which are common. So there's an intersection over there. The second piece that DIISHA will help as a test case would be to be able to address and check state preparedness on the implementation. When the rubber hits the road, you've got to be able to test what is the state's preparedness and capacity to be able to deliver some of these large, very complex pilots. And the third one is that this will provide you with a model, albeit it is only in one of the verticals of human health right now, in terms of being able to generate, as I said, meaningful, actionable grassroots data. And this data will be housed or secured and accessed in state and federated servers, and that will lead to high quality analytics. But the big other part that I wanted to highlight is that you have ASHAs, who are the sentinels, sitting out there, practically the only touch point for the state for 65% of our population. And these ASHAs can be used and leveraged as effective frontline listening systems in the village ecosystem that goes on issues way beyond human health. And when I start to look at all of this, I think we are at a very exciting time. And I do believe that, during the day, we will find time for good deliberations, great insights, so that we are able to help build one health, one nation, and one future. So I look forward to today's presentations and conversations, most importantly. Thank you very much.